Ever pondered over the effectiveness of Stendra and Viagra? Both are renowned for their prowess in combating erectile dysfunction, but how do they really stack up against each other? Stendra and Viagra share common ground as medications developed for treating erectile dysfunction. They're part of a family known as PDE5 inhibitors, which function by boosting blood flow to the erectile tissue within your penis. Yet their similarities end there. In the race against time, Stendra takes the lead with its rapid action. It typically springs into effect within 15 to 30 minutes. On the contrary, Viagra asks for a patient wait of 30 minutes to 1 hour to show its magic. While both increase blood flow to your penis, Stendra is more selective in its action. This implies a slightly lower risk of side effects compared to Viagra. One myth needs busting here. Neither Stendra nor Viagra kickstart random erections or ramp up your sex drive. They only facilitate erections with some form of sexual stimulation, be it sexual activity or even a fleeting sexual thought. While both increase blood flow to your penis, Stendra is more selective in its action. This implies a slightly lower risk of side effects compared to Viagra. Now, let's talk money. As an older player in the market, Viagra is now available as a generic drug called sildenafil, which is easier on the wallet than Stendra. With Stendra being a new kid on the block, a generic version isn't expected anytime soon. So, which one gets to work faster? Stendra holds the edge here too. It gets down to business in as little as 15 minutes post-consumption. Stendra comes in 3 doses, 50, 100, and 200 milligrams. The 100 and 200 milligram doses usually start working within 15 minutes, making it a handy option for as-needed use before sex. Viagra and other generic drugs containing sildenafil typically spring into action within an hour. This necessitates taking the medication slightly earlier than Stendra. Another feather in Stendra's cap is that it can be consumed with or without food, without any significant impact on its efficacy. Viagra, in contrast, might delay action if taken with a meal, especially a fatty one. So, if you're in search of a quick-acting ED medication that can be taken along with your dinner, Stendra might just be the right choice for you. To sum up, both Stendra and Viagra are potent fighters against erectile dysfunction. However, Stendra's quick action, lower side effects, and flexibility with food consumption make it a more convenient option. But remember, like all medications, what works best for you always depends on your personal health condition and needs.